You're resting, or you're sleeping, or you're just minding your own business, and then wham! Burning pain, joint stiffness, swelling. What's going on? Dr. Nora Singer's here to tell you that you could be having a bout of gout. Dr. Singer is the director of the Division of Rheumatology at Metro Health. Thanks for joining us.
My pleasure.
You have the goods on gout, so tell us, what is it?
Gout is an inflammatory problem where crystals called monosodium urate crystals precipitate out in the joint. So it's sort of like putting flour in water, if you want to imagine it, and you get crystals in your joint. They cause inflammation kind of cells to come in and a lot of pain. You can have pain, redness, and swelling, and you can even think sometimes that you might have an infection. And so it's important to have help distinguishing between gout or related conditions and infection.
Now, rheumatology, so is this a form of arthritis?
It is a form of arthritis. The estimates of how many people have it is somewhere between 1% and 4%, so up to 8 million Americans potentially have or have had gout.
And a lot of people get it in their toe?
We think about 50% of presentation of gout is in the toe. So when you think about those pictures in museums of people with their foot out and a red toe, that's what they're talking about.
All right, so how long would an attack last typically?
An attack can last anywhere from a couple of days to a week to a couple of weeks, depending on whether or not it's treated.
And who's most at risk for this?
So we know that there's genetic predisposition, but also if you have kidney disease, if you take certain kinds of medications, and if you have what's called a purine-rich diet, or you eat a lot of liver and internal organs from animals, that predisposes you to it. And alcohol can also precipitate an attack, beer more than the other alcohols. So if you have gout, you want to be moderate with alcohol intake.
What about like rich meats, if you eat a lot of red meat?
Yes, it absolutely precipitates a gout attack if you're predisposed. Obviously, in people who don't have high uric acid in your blood, so often you start off having high uric acid in your blood for one reason or another. Either you make too much or you get rid of too little. And eating foods that trigger it can. So
when we used to hear that kings, rich people, got gout, that's because they were eating rich foods. So there really was something to that.
There absolutely is. And so one of the approaches to managing gout is to ask people to take a low purine diet. So more dairy, more cheeses, less rich animal products, and less alcohol.
Are there treatments for gout if you get it?
There absolutely are. We divide treatments into two categories mainly. One is to control the acute symptoms, get rid of the pain, get rid of the swelling, and then there's also medicine to chronically keep it under control and try and get the uric acid out of the body so that you don't have continued gout attacks or get white accumulations in the skin called tophi.
I heard once eating cherries can help. Is that a Bubba Meister, or is that true?
No. So there was an article in about 2012, and I can send you the link to that, that suggested that people who ate cherries had less attacks of gout. And so people are now looking at what properties of cherries do that. It's not an official treatment yet. But cherries and cherry extracts seem to be helpful at reducing or preventing attacks.
So right now, our viewers shouldn't run out and buy cherries. If they think they might have gout, go see their doctor and get real medication.
Correct.
Okay, thank you, doctor. Appreciate the good information. Gout, like any type of arthritis, can be a big pain. To downsize the comfort, follow Dr. Singer's advice and use the information that's coming up next to learn more. My thanks to Doctor of Rheumatology, Dr. Singer, for visiting our joint today.
Find out more by calling Metro Health Division of Rheumatology at 216-778-4765 or visit www.metrohealth.org/rheumatology. Want more Metro Health medical information? Be sure to tune in to WTAM 1100 each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, so much stuff, so little space.